doctors of AIIMS. Listen.
WhatsApp social groups, and they get spread very quickly. So this may be another reason why the news is coming more people are being aware of this thing. So that is another factor. Then is the final the aspect about the COVID vaccine. Now the COVID vaccine, whether it led to some rare side effect, see, it is not a common side effect. This has been studied. The vaccines were studied very well, and the follow-up was done. So soon after vaccination, there was no significant increase in any side effects. What we are talking about is that very small, let's say 0.001 increase, if it is there, then over the population it will show up, and then it can be. So that is extremely small, and that will be negligible in compared to the benefits which is caused by the vaccine. So that is one thing. Secondly, the complication here is that vast majority of population was vaccinated. So there is no comparative group. Everyone was vaccinated. So we don't have a group that those who were vaccinated versus those who were not vaccinated. We cannot compare because there were hardly any who were not vaccinated. So that is similarly COVID occurred almost everyone got COVID. So that also was the issue that you don't have a comparison group. But despite that, studies have been done by ICMR and by AIIMS, and they have shed some light, and especially like to bring to notice the ICMR study, and they had done a case control study, and they found that the sudden death, and they studied in the younger patients also and older persons also, and you see what they found, what were the major factors which led to kind of increase in the chances of sudden death. And these factors were that if there is a past COVID hospitalization, those who were hospitalized for COVID, they had increased risk. Family history of sudden death. If somebody has a family history, because these hypertrophic cardiomyopathy and channelopathy, they often run in families. So that leads to increase, and that is very much understandable. Then binge drinking 48 hours before death. Those who take alcohol and binges, they are more prone to have sudden death. And these are all documented. These are there in the studies, and it is well documented. Use of recreational drugs and substances. So use of recreational drugs and substances was clearly associated with episode of sudden cardiac death. And similarly, these also include the performance enhancing agents, or those agents which are used for bodybuilding, and supplements which are used. So they also come in these categories. So then performing vigorous intensity physical activity 48 hours before death. So very vigorous activity. Some people are so motivated, they want to do real strong exercise, etc. So those kind of things, they are also more prone to have sudden cardiac. So these were very clearly outlined in the study. About the COVID, it was clearly shown that those who got COVID vaccines, they were actually having less risk of sudden cardiac death. Those who got two doses lowered the odds of unexplained sudden death by 50%, 49%. The hazard ratio was 0.51, that is 49% reduction in incidence of death was there. So this is very clearly showing that COVID vaccine was actually beneficial and not really harmful.
Dr. Karan, would you like to add something?
So COVID, like any pandemic, जब जैसे pandemic situation होती है, तो pandemic में the most important concern was risk to life. So the risk of mortality, यानी जो हम death का risk बोलते हैं,
शिफ्ट नहीं होगा भाई, ये इन्हीं को आना पड़ेगा। चेयर हम पीछे जाते हैं।
So कोविड जिस तरह एक पेंडेमिक की सिचुएशन आती है, द रिस्क वाज कि बहुत ज़्यादा लोगों को इट्स अ रिस्क ऑफ लाइफ, एंड यू नीड वैक्सीन जिससे हम लाइफ प्रिवेंट कर सकें. तो कोविड वैक्सीन्स वर इफेक्टिव वैक्सीन्स, एंड दे प्लेड, उन्होंने रोल काफ़ी प्ले किया जिससे मोर्टेलिटी वाज रिड्यूस्ड. एंड जब हम बात करें कि सिचुएशन ऐसी है कि पेंडेमिक चल रहा है, सो वैक्सीन इज़ समथिंग विच इज़ द ओनली पॉसिबल मेजर जिससे आप लाइफ प्रिवेंट कर सकते हैं. सो आई थिंक द वैक्सीन्स were used, they were used in बहुत large number of people, and they were effective, जिससे कि they had a lot of benefit in preventing the excess mortality, जो lives were prevented. तो अगर हम absolute term में ये बात करें कि risk benefit profile, तो जो benefit vaccines provide करती हैं और जो vaccines ने benefit provide किया, उसका magnitude बहुत ज़्यादा है. और जहाँ तक जैसे बात की अभी डॉक्टर नारायण ने भी कि सडन कार्डियक डेथ पे भी कुछ ऐसी स्टडीज़ हुई हैं जिन्होंने जितनी भी कोविड वैक्सीन अभी तक यूज़ हुई हैं उनका एक रिव्यू करके डेटा सिस्टमेटिकली रिव्यू करके कि क्या कोई एक्चुअल में सिग्नल है सडन कार्डियक डेथ से। हार्ट के भी जैसे बहुत सारे सिम्टम हो सकते हैं, सडन कार्डियक डेथ से कोई क्लियर एसोसिएशन ऐसा उन स्टडीज़ ने क्लियर शो नहीं किया है, जो भी इस स्टडी के बारे में बताया। तो ये बात करें तो वैक्सीन्स यूज़ करना काफ़ी ज़रूरी है। वैक्सीन्स इन पेंडेमिक सेटिंग वही एकमात्र एक रास्ता होता है जिससे आप एक खतरनाक जानलेवा बीमारी से आप जीवन बचा सकते हैं। एंड वैक्सीन्स मेरे ख्याल से जितने भी लोग यहाँ बैठे हैं सब ने कोविड वैक्सीन को यूज़ किया है। तो आई थिंक देखा जाए तो जो बेनिफिट की बात है वो वैक्सीन्स की, वो किसी भी एक जो स्मॉल अप्रिशिएबल रिस्क जो भी उसके मुकाबले में काफ़ी ज़्यादा बेनिफिट है।
नहीं बड़े कुछ और कोई और ऐड करना चाहते हैं कुछ?
So I thought
You want make a question?
Yes, yeah, please.
ये जो स्टडी की है ICMR और AIIMS से लेकर के जो पर एक स्टडी की है, क्या ये कोवैक्सीन और कोविड से दोनों के हुई है या फिर कोवैक्सीन की है?
ये जो स्टडी अभी जो प्रोस्पेक्टिव स्टडी जो हो रहा है in collaboration with ICMR and AIIMS, I am part of the study along with Department of Forensic Medicine. Dr. Abhishek is also there. So there is a lot of questions. We spoke about the benefits of Covaxin, mortality benefits. There are less mortality. That's all fine. So there are still question remains is whether this vaccine is causing some kind of a death or not. Still that question remains with all of us. If you can correct me. उसी के लिए हम यहाँ पे बैठे हैं. Thing is to see whether the death what is occurring in young individuals, especially in India, whether there is any relation to the Covaxin, I mean the vaccine, COVID vaccine or not. So इसके लिए हमने prospective study की. So we had few original studies. One was in the acute phase of COVID, जिसने जो admit हुए थे cardiac, I mean intensive care में जो मर गए. So we examined some samples of all the organs in these patients. The most common cause when the patient is having acute COVID infection is lung infection, lung damage, severe lung damage. उसके बाद everybody knew that lung damage हुआ, oxygen therapy fail हो गई and the patient went for multi-organ failure and he died. So that was the cause they expected and even our histopathology, microscopic examination, everything showed the same similar results. उसके बाद क्वेश्चन आई why after the COVID infection who survived? So almost all of us had some evidence of different severity of COVID infections, right? So there is nothing